In this world, where cigarette smoking is costing more than 7 million lives, $2 trillion in healthcare and lost productivity, where smoking remains the leading cause of preventable deaths from cancer, people still smoke. What does smoking do? We all know that smoking increases the risk for serious health problems, diseases, and death. We know about the increased risk for lung cancer, heart disease, stroke, COPD, emphysema, and infertility. It also increases the risk of cancers of the esophagus, throat, bladder, cervix, and pancreas. Smoking is the most preventable cause of death. In 2016, Tobacco Atlas estimates that tobacco use killed almost 7.1 million people. Tobacco is also a risk factor for the 4 leading non-communicable diseases: cancer, heart disease, diabetes, and chronic respiratory diseases. How about nicotine? What is nicotine? It is a chemical which is a highly addictive substance. The big reason why it is hard to quit smoking, it is a stimulant. In the US, more people are addicted to nicotine than any other drug. It may be as addictive as heroin, cocaine, or alcohol. The tobacco industry and economic burden. According to the 4th edition of the Tobacco Atlas, estimates of revenues from the global tobacco industry approach $500 billion annually. In 2010, the combined profits of the 6 leading tobacco companies was $35.1 billion, or close to the combined income of Coca-Cola, Microsoft, and McDonald's in the same year. If big tobacco were a country, it would have a gross domestic product or GDP of countries like Poland, Saudi Arabia, Sweden, and Venezuela. What is the economic cost of tobacco use? Globally, it is $2 trillion, or 2% of the combined global domestic product. Tobacco Atlas further state that countries do not profit economically from tobacco production and consumption. In fact, it causes harm. The direct and indirect cost of health care for smoking-related diseases, lost productivity, and deaths can cripple economies. In 2000 to 2004, cigarettes sold in the US amounted to $71 billion per year. The economic cost? $193 billion in annual health-related economic losses. Rapid-fire numbers. There are now more former smokers than current smokers. There are immediate and long-term health benefits of quitting for all smokers. Within 20 minutes, your heart rate and blood pressure drop. 12 hours, the carbon monoxide level in your blood drops to normal. 2 to 12 weeks, your circulation improves and your lung function increases. 1 to 9 months, coughing and shortness of breath decrease. 1 year, your risk of coronary heart disease is about half that of a smoker's. 5 years, your stroke risk is reduced to that of a non-smoker 5 to 10 years after quitting. 10 years, your risk of lung cancer falls to about half that of a smoker, and your risk of cancer of the mouth, throat, esophagus, bladder, cervix, and pancreas decreases. 15 years, the risk of coronary heart disease is that of a non-smoker's. People of all ages who have already developed smoking-related health problems can still benefit from quitting. Benefits in comparison with those who continued. At about 30, gain almost 10 years of life expectancy. At about 40, gain 9 years of life expectancy. At about 50, gain 6 years of life expectancy. At about 60, gain 3 years of life expectancy. After the onset of life-threatening disease, rapid benefit. People who quit smoking after having a heart attack reduce their chances of having another heart attack by 50%. Quitting smoking decreases the risk of many diseases related to secondhand smoke in children, such as respiratory diseases like asthma and ear infections. Others benefit. Quitting smoking reduces the chances of impotence, having difficulty getting pregnant, having premature births, babies with low birth weights, and miscarriage. What's the deal with smokeless tobacco? How about smokeless tobacco? Smokeless tobacco is tobacco that is not burned. It is also known as chewing tobacco, oral tobacco, spit or spitting tobacco, deep chew and snuff. Is it harmful? Yes! There is no safe form of tobacco. At least 28 chemicals in smokeless tobacco have been found to cause cancer. It can cause esophageal, oral, and pancreatic cancer. How do I quit? Because of its addictive nature, it is challenging to treat. There are several programs which can help you quit smoking. That will vary on where you are. You can ask your doctor for options. In the US, There are quit lines you can call to direct you to the best resources. 1-800-QUIT-NOW. Individual, group, or phone counseling are also available. There are also medications available which can help. Nicotine replacement products include nicotine patches, gums, and lozenges. Prescription medications include nicotine patches, inhalers, and nasal sprays. There are also prescription non-nicotine medications such as bupropion SR, also called Zyban, varenicline tartrate, also called Chantix. Combining counseling with medications will increase effectivity. Interestingly, increasing the cost of tobacco products is the single most effective way to reduce consumption. A 10% increase has been estimated to reduce overall tobacco use by 3 to 5%. Thank you for listening. If you like this video, please click the like button, hit subscribe, and ring the bell. Be healthier.